Good evening, everybody. Welcome to this Facebook Live session on breast cancer awareness. October is the Breast Cancer Awareness Month, and thank you for coming here and showing your support to spread awareness. I'm Dr. Vijay Karan Reddy. I'm a consultant radiation oncologist working in Apollo Cancer Hospital, Jubilee Hills. I have more than 10 years' experience in the field of oncology. Breast cancer right now is the most common cancer in women in India and all over the world. Especially in India, we see about 1 in every 7 to 8 women being diagnosed with breast cancer. Most of you, I'm sure, know somebody in your family or in your friend circle who have been affected by this dreadful disease in one way or the other. So it is very important for you to be aware, for you to know how to detect it early, and once detected, how to go about what are your treatment options, how do you deal with the treatment, and also what your life would be after cancer. So thank you for joining us. And as we go through the show, I will be taking any questions that you have, answering any of the questions that you have. I will also try and shed light on some of the common things that you should be aware of. Thank you. So the first question is what age does breast cancer occur? So breast cancer is most common in the age of 40 years and above. Nowadays, we are seeing a lot of cases in much younger age group for around 30 to 40 also. But as a precautionary measure to be aware in terms of your age, 40 years and above is something that you should consider. And 40 years and above is the recommended age for people to undergo mammogram yearly as well, as per the international guidelines. So most common is 40 to 50. 50 and above also, we see a lot of breast cancer cases. So the next question, if there's any other question, what are the ways to detect breast cancer early? So this is a good question. There are many different ways that you can do this. You can, so I will list out step by step. One thing that you can do is self breast examination, which is the simplest and the easiest and the most uh, convenient way that you can look for breast cancer early. Self-breast examination is just that whenever you're having a shower or whenever you're in the bathroom in front of a mirror, just make sure that you feel your breast once in a clockwise direction, once anti-clockwise direction, and keep applying pressure and press on it to feel for a lump. If there is any lump that touches your finger, you need to get it tested, need to visit your doctor. The other way that you can detect breast cancer early is, like I said, 40 years and above. Make sure that you get a yearly mammogram, yearly checkups, whether it is a gynec examination or a breast examination done. Regular health checkups is a very important thing in breast cancer and other cancers also to detect it early. The other way, apart from 40 years and above, if you have a family history of breast cancer or ovarian cancer, whether it is a first degree or a second degree relative, I would recommend that you get a mammogram done much earlier, that is from 35 years of age itself. These are primary prevention. That is, you try to, even if you are going to get breast cancer, you try to detect it as early as possible. Then there are a lot of things that you can do to prevent breast cancer. However, these are not definitive methods. There's something that you can look out for. Try to maintain a healthy high diet. Do regular physical exercise. Obesity is a huge risk factor for breast cancer. Family history is a big risk factor for breast cancer. So if you have family history in your first or second degree relative that with breast or ovarian cancer, make sure that you check yourself, start checking yourself earlier at an early age, and also be more aware and check yourself regularly throughout your life. The propensity of you getting breast cancer from your family member is higher when it is a first degree relative. That is, if it's your aunt or your mother. If it is your aunt, mother's sister, that is a second degree relative, then the chance of you getting breast cancer slightly comes down, but still it is still considered a high risk. Apart from healthy weight, physical exercise, family history, avoid drinking and smoking. That holds good for all types of cancer. So that is something that you need to avoid. Make sure that you have a healthy diet. Again, this also holds good for every other type of cancer. You have to have a balanced diet. You have to make sure that you stay away from things like red meat. You have more of fruits and vegetables in your diet. In terms of protein, make sure you have some, fish and seafood is something that is very rich in protein and very healthy for you. Try to avoid red meat like mutton or beef. So these are some of the common things that you can do to prevent breast cancer. and some of the things that you can do to detect it early as well. I hope that answers your question. Is there any other question? So, like I just discussed, if it is a first degree relative, you have a very high chance. The way that you can test this is by getting a genetic mutation done. So, imagine that you have your mother who has had breast cancer, undergone treatment with breast cancer. Then you get a genetic mutation called BRCA, that is BRCA1 and 2 mutation testing that is done. You see if it is positive or negative. If it is positive, you have a very high chance, that is more than 90% chance, that you might have breast cancer or ovarian cancer during the course of your life. If it is negative, it does not mean that you will not get breast cancer, but the chances of you getting breast cancer is much, much lower. The As a recommendation, we would say that get genetic tested, especially if it is a young female, 30-40-year-old female getting breast cancer. You have to get genetically tested to make sure that your kids in the future will not have breast cancer because of these mutations. But the sad thing is, even if it does come positive, there is nothing much we can do. An extreme measure is that, like you must have heard in the news about Angelina Jolie. So she had a very high risk of breast cancer. So she got both her breasts removed. That is a very extreme measure, and many of them might not be okay with it. So even if you become mutation positive, there is not much you can do. At least you can be aware of it, and you can keep an eye out for it. And the doctor also will be aware. He'll make sure that he does a regular health checkup and follows you up vigorously and regularly. So family history, that is yeah, genetic mutation is something that you can do. And a first degree family relative, you have breast cancer, you have to make sure that you start getting yourself tested regularly at an early age. What are the cure rates of breast cancer and which stage is curable? So this is like one of the most common questions. As soon as you say cancer, you ask me, the first question that comes to your mind is it curable? Is there something that we can do about it? What will be the life after cancer? So in overall, if you look at all stages of breast cancer together, still about 50 to 60% of breast cancers are curable. The key to this is to detect it early. When you detect it early, what happens is, one thing, your cure rates are very high. Like a stage 1 breast cancer will have cure rates of more than 90%. In cancer, more than 90% is as good as saying 100%. The second thing about the treatment modality, so if it is an early stage, you do not have to go through vigorous treatments of chemotherapy of 6 months and radiation and that and this. So if it is a very early stage, just do a local excision, just a surgery to remove the tumor, and you're good, and you don't have to do any other treatment. So that is a very big advantage. For you to undergo the treatment, it will be very easy. Your life after cancer will be very easy, and your cure rates will be very, very high. So to answer that question, or overall, 50 to 60% is still curable. The key is to detect it early as possible, and start your treatment as early as possible. Do I need to remove my entire breast for breast cancer surgery? That is again a good question. A lot of people are not aware of this, especially in a country like India, where accessibility to specialist care is very difficult. Affordability is difficult. A lot of times, what happens is a general surgeon or surgeon, in a district or a village, where as soon as they identify a breast tumor, the first thing that they will do is operate and remove the breast. So there are many options these days, depending on the size of your breast, the size of your tumor, relative size of the tumor with the breast, whether it is in one location or multiple locations, whether your young age or an elderly age, your patient preference, whether you want to remove only the tumor or the entire breast. There are many surgical techniques right now, especially robotic surgery has also come to be as minimally invasive as possible and remove as less tissue as possible. So post surgery also, your recovery will be faster. Your life after treatment would be as close to normal as possible. There is no compulsion that you have to remove the entire breast. Entire breast is removed only in advanced cases. Early stages, you can remove only the tumor along with part of a normal tissue. You can preserve your breast. You can also have oncoplastic procedures later, or in the same surgery session, to make sure that you maintain the cosmesis of your breast. So be sure that as soon as you get detected with breast cancer, don't be in a haste to get the entire breast removed. Please be sure to meet an oncologist, specialist oncologist, who will give you all these options, where part of your breast and only part of your lymph nodes from the axilla. So the first site of drainage is to the axilla from the breast. So when you remove the tumor from the breast, many of the surgeons remove the entire lymph node. So you don't have to do that. You can do part of the tumor without removing the entire breast and only a single lymph node. So the morbidity post surgery, the life post surgery would be much more convenient and easier for you. The next question is, what when do I need chemotherapy and what are the side effects? So, like I already mentioned, earlier the stage, easier the treatment. So, when you detect the cancer in very early stage, that is stage one, only the tumor can be removed, surgery can be done, and beyond that, mostly you would not require any further treatment. There are a lot of other molecular factors that we do consider and then take a call, but mostly, or as a blanket statement, you don't need further treatment when it is very early stage. Anything beyond stage one, from stage two onwards, stage three onwards, forwards, you do need chemotherapy. And chemotherapy depends the type of chemotherapy given, the frequency of chemotherapy given, the number of cycles of chemotherapy given. All of these are they are decided based on the clinical stage, based on the size of the tumor, based on how many lymph nodes are positive, based on molecular factors of the tumor. There are receptors called hormone receptors, ERPR, and another mutation called HER2 new mutation. We look at all these three factors together, the tumor factors together, put all of them together, and then decide. If it is very early stage, these days we have an option to give only 4 cycles of chemotherapy. Chemotherapy is usually given once in 3 weeks. Uh, as a prolonged course, when it is stage three and little advanced, locally advanced disease, what we call, we give up to 8 cycles. So 6 to 8 cycles is the maximum. 4 cycles is the minimum. The type of chemotherapy again is decided, like I said, based on the tumor factors and the molecular factors. The side effects, no matter what type of chemotherapy you give, in general, breast cancer chemotherapy, the most uh, bothering factor for many of the patients is that the hair loss. But what you need to know and be aware of is hair loss is not permanent. Once the chemotherapy is done, you get back your hair. It's just like shaving your head for God, that you shave your head before you start chemotherapy. And once chemotherapy is done, it takes about 4 to 6 months. You might not get back your 100% original hair, but you will still get your hair good enough to, uh, look good and style your hair as much as you can. So that is not something that you should be worried about. People try to avoid chemotherapy and get scared of chemotherapy because they're going to lose their hair, but do not worry about it. You will get back your hair. The other side effect going on during chemotherapy, common side effects, is you get tingling sensation of the hands and feet, which is again very common. That happens because of one particular drug that might be given. If you get that, there is no particular cure for it. What we usually advise patients is to keep your hands and legs active as much as possible, that you use those balls or this thing to hold your hand and keep pressing on them. There is a tablet that you can use to reduce your symptoms, but once the chemotherapy is done, again, this is something that will resolve by itself. Some people have it more severe. If it is more severe, then we stop the chemotherapy. If it is tolerable, then we continue. Whatever it is, once the treatment is done, slowly and surely the tingling sensation will come down. During chemotherapy, another side effect is nausea and the blood counts falling down. Again, nausea, blood counts is differs from patient to patient. Is not always the same. It is again controllable with medication. Nothing so severe that you will not be able to eat at all, or you'll reduce weight as such. In certain types of chemotherapy, other types of cancers, nausea, vomiting, loss of appetite is very severe. Breast cancer chemotherapy usually is quite easily tolerable, and whatever it is, again, it is controlled with medication. So to list out the side effects: hair fall, tingling sensation in the hands or feet, which are both of them are common, and they're only temporary during chemotherapy. Both of them resolve once the chemotherapy is done. Fallen blood counts, having nausea, and loss of appetite is again seen during chemotherapy itself, and which is controlled with medications. So next question: what is radiation and when do you need it? So a lot of people have this misnomer about radiation, that as soon as you get radiation, you will be giving radiation to people around you. The bad sense of radiation is nuclear radiation. What you always think, as soon as you say radiation, that's what your mind goes to. But the radiation that we give in breast cancer is treated and used in cancer is basically X-ray radiation. So there is X-rays that you do when you have a broken hand or a broken part of the body, or a chest X-ray. In those, we use very low energy kilovolt X-rays. The same X-rays, when they are used at million volts or very high energy, they are directed towards the tumor area and used to kill the tumor cell, and that is what we call as radiation. When do we need radiation? Again, early stage, if it is stage one, you do not need radiation. Later stages, usually along with after chemotherapy, you need to add radiation as a precaution treatment to prevent recurrence, usually in advanced stages. The other important uh, indication for radiation is in early stage, like I said, there's an option that you remove the entire breast or you remove only the tumor. So when you remove the entire breast, early stage, that's about the treatment is. When you remove only part of the tumor, then you have to add radiation to it. So as soon as you say add another treatment, there's nothing that you need to be worried of. Amongst all three, radiation is the simplest that you can tolerate, usually given over 5 weeks. But the newer techniques with the kind of technology that we have, machines that we have, we can deliver it in a week or even 3 weeks or within even a week also. Again, radiation side effects very minimal, very transient, doesn't happen to everybody. Only during only during treatment you face these problems, and easily controllable with medication. So early stage, you do radiation when you remove only part of the tumor and not the entire breast. So the result with removing entire breast is equal to removing part of the tumor plus radiation. The other indication is locally advanced, stage 2 and above, whenever the size of the tumor is more than 4 centimeters and the tumor has spread to the axillary lymph nodes, is when you add radiation to the treatment. Next question. Are there any newer treatments? Breast cancer is one disease where all three treatments are used most commonly. Hopefully, if people are more aware in the future, then you detect it early, then you can try and avoid one of the treatments as much as possible. But surgery, radiation, chemotherapy are always used in tandem as a combination in different sequences. So all the studies all these years have been to try and reduce the amount of radiation, reduce the amount of chemotherapy that the patient has to undergo. But more or less, what we see 80 to 90% in our clinical practice is all the patients will take all three types of treatment. When it comes to newer treatment, only newer treatment that in terms of surgery, I would say I would, like I was saying, remove the tumor, not the entire breast. Remove only single lymph node, not the entire lymph nodes from the axilla. Because once you remove the entire lymph nodes from the axilla, then lymphedema of the hand and movement of the hand later post treatment would be is a complication that we see. So removing part of the tumor breast only containing the tumor, maintaining osmosis, preventing lymphedema by removing only one. In terms of surgery, that is something that is new. When it comes to radiation, initially, for a very long time, we used to give radiation for about 5 to 6 weeks. The newer radiation techniques have reduced the time more and more. From 5 to 6 weeks, we have come down to 3 weeks, and from 3 weeks now we have come down to even a week. So within 4 to 5 days, 4 to 5 fractions of radiation, we can finish it off, which is very convenient to the patient. Again, side effects are not higher when you compare it to a longer treatment. Just because we're giving higher dose doesn't mean that you have more side effects. It is still tolerable. We have enough data to support this. In terms of radiation, another new treatment that has come is proton therapy. So when it comes to radiation, apart from the acute side effects, like I said, there are tolerable side effects. The late side effects are, there is a possibility of a 5 to 10% possibility that there might be some toxicity to your heart or your lung, because that is the part of the body that is very close to the breast. So in terms of radiation, the newer radiation techniques that we use with 3D, 4D CTs, where we monitor the movement of the lung and treat, even with that, there is still a particular amount of dose, even though it is below the dose constraint that we use, particular amount of dose still goes to the heart and the lung. But in the latest now that we have available in India, that we proton therapy, the only one in Southeast Asia, we have it in Chennai. Apollo Chennai has it. So proton therapy, what it does, it reduces the side effects even more, even compared to the most advanced radiation technology that we have. Proton therapy reduces side effects even more, and the effect on the heart, like I said, 5 to 10% of chance of something happening to the heart or lung later in your life, that also is reduced to less than 1%, less than 2%. So proton therapy is something that you can look at, and protracted treatment, that is finishing the treatment within 1 or 3 weeks, is something new in radiation. When it comes to chemotherapy, there is not any particularly new. However, there are newer protocols coming to try and reduce the intensity of treatment, reduce the number of cycles if it is an earlier stage, reduce the number of cycles if it is favorable tumor in terms of molecular factors and size of tumor and other things. That is something new. And beyond that, we have targeted therapy and hormonal therapy, which has been there for ages, that has been going on. If you have a particular mutation positive, HER2 new, you have to give targeted therapy. Immunotherapy is something that has been looked into, which work is still going on. But as of now, immunotherapy is not the mainstay of treatment. It is not a curable treatment. Only at the end stage, only if required, if nothing else is working, you could try only at a trial and error basis. There is no definitive data which says that even in stage 4 breast cancer, if you give immunotherapy, that your survival or your chance of prolonging your life have improved. So yeah, so the in dividing all three, these are the newer treatments that are available. The only way that you can access these newer treatments is when you visit an oncologist. It has to, you have to go and see a specialist oncologist. Do not go to just any surgeon and get it operated. Be sure that you take an opinion of a specialist. So the next question is, any other questions? So I think if there are no other questions, I feel that I've covered most of it. Early detection, self breast examination, mammogram, regular health checkups is very important. Uh, Preventing, of course, have a healthy diet. Make sure that you're not overweight. Physical activity is very important. Staying away from smoking alcohol is very important. Having a balanced diet is very important. This takes care of the early detection and prevention. Once you're detected with cancer, depending on the stage of your cancer, your oncologist will prescribe the treatment for you. It can be all three, that is surgery, chemo, radiation, in a combination, or it could be one or two of them, depending on the tumor, depending on the size of the tumor, depending on the molecular factors, so on and so forth. And you be sure to, like I said, be sure to meet an oncologist, because he would give you the correct treatment, give you the best possible treatment. Curing the disease is one thing, but beyond that, getting the appropriate treatment for the disease is important, because your life after the treatment should be normal as possible, if not completely normal. And the chance of you getting the cancer back should be minimized as much as possible. So having a specialist protocol based treatment is very important. So moving on, this other part of it is other part of this live session is that I thought that apart from knowing the treatment and prevention and early detection, you should also know a little bit more about how to tolerate the treatment, especially for breast cancer patients. Like I said, 6 to 8 cycles of chemotherapy is a very long treatment, and having nausea, loss of appetite, patients find it very hard to maintain a healthy diet, and hard to the attenders find it hard to find something interesting for the patient to have and to maintain their energy level and their weight, which is very important to tolerate the treatment. So we are very lucky and happy to have Dr. Megha Mukhija, who's a dietitian, joining us in this session. Sorry, I got
Hello, sir.
Dr. Megha. Hi, how are you?
I'm good. How are you?
Doing very good. Thank you so much for joining us. It's a pleasure to have you. And like I was just telling all our members here, that diet is one of the most important factors. Even if it is when you look at prevention of cancer, having a balanced diet is very important. And at the
Yes,
same time, on treatment, this is one of the biggest challenges that we have. Having symptoms and getting medicines for it is one thing, but to make sure that the patient has a balanced diet, doesn't lose weight, has enough energy levels to go through the treatment, is very important. So thank you for joining us, and hope you enlighten us more on that.
surely I'll try my best.
So I think we have a few questions.
Sure.
So I think the first question is about how to prevent breast cancer. So I have shed a light up a little bit about this in terms of an oncologist. So please, in terms of a dietitian, please suggest what we can do.
Surely. So the first and foremost thing which I with the urban population, shift in the society where people are not breastfeeding much because most of the women are working professionals, so they want to get back to work as soon as possible, and maternity leaves are much not much possible in a lot of professions. So people do not breastfeed enough. This is one reason, and one reason of matlab, this is one factor wherein we can prevent breast cancer, breastfeeding as long as you can. And this is a proven thing with lot many researchers that breastfeeding can help reduce the chances of breast cancer. So at least with people who are predisposed with genetic history should focus on breastfeeding their kids as much as possible. Second factor is alcohol intake. So we have been seeing a huge increase in consumption of alcohol. So maybe we can say effect of social media or effect of post pandemic. People are going revenge outings. People are doing, they are doing more frequent outings, as if they were locked for so long. So now they are doing revenge outings, revenge alcohol, revenge on food. So that is another reason that people are not moderating their alcohol intake and having beyond the permissible limit. So alcohol if taken in moderation is no problem, but alcohol if taken in huge amount in with with bad lifestyle can definitely predispose you to cancer, and not just breast cancer, a lot many other cancers as well. Then another thing which I have seen has changed a lot in the recent time is physical activity. We are in the job, work from home people. Some professions are continuing their work from home. So I've seen people not doing the exercise, not being physically active. They're sitting at one place, sitting on the bed with their laptop for 10 to 12 hours, working on it, not moving. When we go to office, we still move a bit, but sitting at the comfort of a home and doing work. So I think people have completely lost over the physical activity phenomenon or their routine the post pandemic. So physical activity pre pandemic, post pandemic is a very important factor when we say prevention of cancer. And according to the WHO guideline, it is not just simple walking or simple cardiovascular activity that will help you. It should be like 150 minutes of cardiovascular activity, aerobic activity for in a week. So it could be walking, swimming, jogging, and along with at least 45 minutes for 2 sessions of 45 minutes each with muscle training. So be it your body weight training, body resistance training, or it could be lifting weights, or and doing any kind of strength training. But this not just walking alone won't help you. Doing some sort of exercises which improves muscle is another crucial factor. Then also specifically menopausal women, they, and not just menopausal women, women suffering from PCOS, they start taking hormonal therapy. They don't go back to their doctors, they continue on their own, and they're taking hormonal pills for a very long period without knowing the risk that those pills can predispose them to breast cancer. So it is important to look out for alternatives which are very much available. So we can look for non-hormonal therapies, and we can look for supplements which can help them regularize their periods or help them with menopause symptoms. Another and the biggest factor is obviously a healthy diet and a healthy lifestyle and eating less of processed food. I know we live in a very busy era. Cooking food and cooking food from scratch becomes a very big task. But then we can opt for some recipes which are very easy and very quick to make, which suits our taste bud. And we should and try to limit the consumption of processed food, using the pre-made sauces, using pre-made breads, using the pre-made pizza bases. We should try and avoid as much as possible. Another healthy diet considerant that we should take care of is there should be enough fruits, vegetable, and nuts intake in the diet. People eat normal food. They think we are eating healthy. They are eating roti, rice, dal, vegetable 2-3 times a day, but they are not focusing enough on the consumption of fruits and specifically nuts. I take dietary calls and I'm surprised. I ask people, and it is like 6 months, 7 months down the line, and they have not taken any kind of nuts, or they are just sticking to the basic almonds and they're not moving ahead. We have a wide variety of nuts and oil seeds in our country, and we should include all the local nuts and oil seeds available: pumpkin seeds, sunflower seeds, flax seeds, almonds, pistachio, cashew. We should not fear any of the nuts thinking it will lead to again, if you include healthy nuts, it actually suppresses your appetite and helps you eat less. So it will help you maintain weight instead also. So eating a healthy diet along with good amount of fruits, vegetable, and nuts is also important. Sticking to only roti, sabzi, rice in all three meals will not lead to any miraculous result in the body. Another important factor is, I have seen a lot of people not maintaining healthy weight. I'm not saying go to the zero size figure or be on a very leaner side, but yes, maintain a healthy weight wherein you are disease free. You are not having any metabolic syndrome. You're not having any metabolic disease like diabetes, dyslipidemia, or any high cholesterol levels or anything. We should maintain a weight wherein our body is completely healthy. We feel absolutely active, full of energy. It is not about going to the ideal weight, but it is definitely about staying at a weight which is healthy for us, and we are disease free at that weight, and we feel absolutely physically healthy. And also we should ensure optimum levels of the basic nutrients. We should go for an annual checkup. We should see, since most of the India is vegetarian, so we should see vitamin D, vitamin B12, folic acid, iron profile specifically in females are in the optimum range, because these could be another factor of predisposing us to inflammation. Specifically, vitamin D has been proven many times that it is the deficiency of vitamin D leads to inflammation, and that inflammation, chronic inflammation, can definitely lead to cancer and many other diseases. So it is again important to keep our minerals and vitamins in check, specifically the most important vitamins and minerals, and we should never supplement. So if deficiency is a problem, over toxicity is also a problem. So which we have been seeing, that people are taking vitamin D supplement endlessly without approaching to the doctor, without getting their levels checked. So it is important to cross check with your doctor and take the supplement as it is required, not endlessly. It is prescribed for 8 weeks, you have been taking for 12 weeks, 16 weeks on your own. So this should not be the case. It should be, or absolutely, after a blood test, or after taking for 8 weeks, you should get a blood test to check what are the levels. So it should not go into the toxicity scenario. So these are the lifestyle prevention things. Then there are a certain food items which can definitely help in cancer prevention. So the number one thing which we should include every day, one or two serves every day in our diet, is either citrus fruit or berries. Berries, as it is, we do not have a lot of local berries here in India. We do have, but it is very seasonal, so whenever they are available we can opt for them. But we do have a lot of citrus fruit, and it is available 12 months around. Either it could be grapefruit, or it could be mosme, it could be orange. Whatever citrus fruit is available, we can try and include that. It is again the anti-inflammatory effect of the citrus fruit and berries, because of the vitamin C component and the citric acid component is so high that it has been proven many times that it helps with the prevention of free radicals. Another thing is fatty fish. So, fatty fish like salmon, mackerel, sardines. So, we do eat fish, but we should know which right fish we should be eating, and we should be eating the lean cut of meat. So, anybody who is a non-vegetarian and eating mutton and thinking that I'm doing a very right thing, so mutton should be moderated because it's a very high fat meat. High fat non-vegetarian sources will definitely predispose to obesity and other metabolic diseases and inflammatory diseases like cancer and allergy. So we should include lean cuts of chicken, fish, which are high in good fatty acids. They're rich source of omega-3 acids, so we should include them. Also fermented food. So South India, I've seen, uses a lot of fermented food. So they eat dosa, idli. I've seen them having a lot of kanji and have a lot of fermented food. But when I on the contrast, when I see North India, I see them, not apart from curd, they are not having any kind of fermented food, because around pickles they have been a myth that pickles give you high blood pressure. So they have stopped eating pickles. So that curd is also very seasonal, because we face very extremities of weather in North India. So when once it is cold, it is very cold. Once it is summer, it is very hot. So again, I've seen people not eating curd 12 months, people eating curd seasonally. So I find them not having enough of seasonal foods which are fermented. So we should try and include kefir, kimchi, pickles, curd, dosa, idli, fermented dal chilas, whatever possible, whatever fermented food we can eat, at least two serves daily we should include. In winters, kanji is another beverage, which is the Indian variant of kimchi or kombucha. We can try and have that. So we should include fermented products because good bacteria is known worldwide. Multiple conferences going on, multiple researchers coming out that good bacteria in the gut is one reason that we can bring down inflammation incredibly. And we have been using probiotic supplements as well. But why not, when we are in the prevention stage? Why not make it a lifestyle and have fermented food in diet? Kidney beans, soya bean. So they are rich source of iron. They are rich source of many antioxidants which are cancer preventive. Specifically breast cancer, specifically in breast cancer. So we should ensure good intake of rajma, lobia, and soya bean, which are the complete bean family. Another thing is cruciferous vegetable, cauliflower, broccoli. But one mistake we do, we just take cauliflower, we cook it and eat it. To activate the enzyme which is cancer preventive, we need to break the florets of cauliflower and keep it aside. We have to chop it in bigger chunks and keep it aside for 1 hour. This will activate an enzyme known as sulforazane, which is cancer protective. So then once we have left it out, chopping in big chunks, once we have left it for 1 hour, then we can cook and eat it. This will activate the anti-cancer component in them. Likewise for garlic and onion. So if we cut and wait for a couple of minutes, for like 30 minutes or so, it will activate allicin in the garlic and onions, which is again cancer protective, prevents cancer. So again, we do use garlic in abundance. We do use cauliflower in abundance in India, but sometimes we fail at using the correct method and technique to cook it. So we need to do that. Cooking can be done completely Indian style, whatever way you like. No need to have it boiled or raw, but chop and wait for at least an hour before consuming these. Green leafy vegetables, for sure, we do have a lot of variety and in abundance. And in India, we can incorporate green leafy vegetables in our dough, in our atta dough, in our rice, in our along with our dal. So it is very easy, along with the chicken. So it is very easy to incorporate green leafy vegetables in our diet, which will again prevent cancer. And we have a very nice variety of herbs which can prevent cancer. For example, oregano, turmeric, being something which is very commonly used in India. But we need to ensure that if we are using turmeric, it is important to use black pepper along, because the curcumin in turmeric is only activated when the piperine in black pepper is available. So it becomes more 2000% more potent. So it is important to use turmeric and black pepper together in food. Having just haldi milk without black pepper will not give you that anti-cancer effect. Rather than having turmeric in something very very common food along with black pepper will help you more. So these are the food according to me which should be used.
That's very, very informative. Thank you so much. So, in general, what you're saying is maintaining a healthy weight is most important. That
Yeah.
is a very common problem, having physical activity.
Yeah.
Obesity, apart from cancer, that gets you so many other diseases also.
Right.
Your heart problems, diabetes, a lot of issues happen because of obesity. And not only breast cancer, it can be a predisposing factor for endometrial cancer, cervical cancer as well. So, that is very, very important. And you have very accurately and very informatively, even for me, mentioned all the food items that are good for us, because it is very important for somebody to like you said, to understand a balanced diet. When
Right.
just because they're having chapati and rice 3 times a day, they think they're having everything. But what
Absolutely.
consists in that plate, what part of it is fruits, what part of your diet is vegetables, what part of your diet is meat, is very, very important to understand. Make sure that we have all types of vegetables in, to have all types of vitamins and minerals in our diet. Thank you so much for that. So the next question, I think, is cancer prevention nutrition hacks.
So
I
like I
think,
said,
yeah,
chop your cruciferous vegetable and wait. The
yeah.
biggest hack. I think like most of the people don't know about it.
Cruciferous vegetables is something that we need. But don't you think broccoli is something that is very difficult for a lot of people to have? I mean,
So
usually
cauliflower.
people don't like it.
Yeah,
Cauliflower is good enough.
yeah, cauliflower is
Okay.
good enough. So it is not that broccoli is better than cauliflower. You can say they are equal.
Okay.
And if you are having cauliflower, it is good enough. But it is a cruciferous vegetable, so chop and wait for an hour and then cook. So that ways
Okay.
we activate the sulforazine, which is an anti-cancer component.
Okay. So in terms of vegetables, green leafy vegetables, cruciferous vegetables are very important. And in
And
terms of garlic and onion. And in terms of fruits, berries and citrus is what you're suggesting.
berry,
Yeah.
citrus, and pomegranate, which we get abundance in India, which is
Yeah.
also
Yeah.
considered berry family only. So pomegranate could be an alternative, which is again available for most part of the months in across all parts of India, could be included.
Okay, thank you. And if there's any other next question. So now you've told us very clearly about what are the foods that will help us prevent cancer. So what are the foods to avoid to that that to prevent breast cancer?
Excess of sugar, I would say, people consuming 2 to 3 teaspoons of sugar, direct sugar, not the processed one coming in donuts and cookies, is fine. Having a half spoon of or 1 spoon of sugar in your tea or coffee is fine. But people don't realize, we have a packet of biscuits, we eat it. We take 2 slices of cake, we eat it. We are casually eating donuts 2 3 times a week. We are eating sweets, and we are not realizing again it has a lot of added sugar, which is cooked and processed. So excess of sugar definitely predisposes you to obesity and other metabolic diseases, increasing the inflammation. So definitely cancer, predisposing you to cancer as well. And another thing, apart from excess of sugar, is excess of fats which are not good. So trans fat and saturated fat. So North India consumes ghee, vanaspati. South India consumes coconut oil. Having coconut oil or ghee is a good thing, but then there has to be a limitation that we only need 4 to 5 teaspoon. A healthy individual only
Yeah,
needs 4 to 5 teaspoon of oil per day, and we end up having a lot more than that. We do not realize that if we are having one donut, we are using that complete intake, the complete the quota of oil in that one donut itself, because it's a deep fried sweet. Or
yeah,
for example, for a matter of fact, any other dessert or any other sweet thing. So we have to see the processed food has a lot of fat and sugar hidden. We don't see it, we don't realize it, but it is there. So we should start reading labels and eating foods which is farm to plate, fresh foods more. If
correct.
you are craving for sweets, why not opt for berries, dates and raisins? It is a better formula rather than having, and they will definitely satisfy you with the sweet craving, rather than opting for something which is full of fat and sugar. Because fat and sugar, when processed and combined together, I think it is the most toxic thing to go into any body,
Yeah,
and it predisposes you to a lot of inflammation in the body. So once you start quitting the processed fat and sugar, you will definitely see a decrease in inflammation, and the better functioning of body is definitely visible for each one of us. And margarine and palm oil, which is used in abundance in a lot of packed and processed food. So all the chips, all the namkeens we get, most of them are made in palm oil. So we have to consciously boycott food which are cooked in palm oil, because it is very high in trans fat, very very bad for cardiovascular health, very bad for cancer. So it is important, even if somebody is suffering from cancer, or is from it's from the post cancer, after cancer treatment stage, it is important that we completely boycott palm oil on the products. Once we start doing that, automatically food industry will have to adaptate some better oil in the foods which we eat. Because no matter how hard we try, sometimes due to some situation we end up eating those packed and processed food. So it is important, as an industry, as a country, we opt for better oils like peanut oil, which is a very good oil for frying. So we cannot completely eliminate fried food, but then we can ensure that we are eating those fried food in an oil which is healthy, not very high in trans fat and saturated fatty acids. And I see FSSAI taking those moves and slowly and steadily moving towards a more healthy oil ratio, more healthy omega 3 to omega 6 oil ratio. So if omega 6 you get from seed oils, the refined oils. So if omega 6 goes high in your body and you do not have enough omega 3, the ratio to of omega 3 and omega 6 is not maintained, then inflammation is bound to happen. So it is important to include good fatty fish. If it's not available, maybe walnut, chia seeds, pumpkin seeds, flax seeds, which are good source of omega 3 fatty acids to the diet. And if nothing is possible, maybe an omega 3 supplement, if required at last, could be used to decrease down the inflammation. Another thing, alcohol, as I already mentioned, alcohol is another thing which is the worst thing, if have if had in unmoderated quantities for cancer. Another, after processed food and alcohol and sugar, I think if you're eating normal food, even if it is fried once in a while, you're having puri bhatura, is fine, but you
yeah,
have to moderate the oil which you are using.
yeah. So I think in general, what everybody needs to understand is anything in excess is bad. So a few months back, I think 1 or 2 years back, there was a study that came in the paper which said sugar causes cancer. So because of that, everybody came and started asking that they should stop having sugar
Right.
completely in their life. So now,
Right.
like you rightly explained, it is a question of having excess sugar and processed sugar, having sugar from all these sweets, processed sweets that we have like donuts or other things. So that is
Right.
what we need to keep under control. Having sugar in your diet and your tea, coffee is still okay, not
Absolutely
something that should be worried about.
not a big
Great.
problem.
And oil, like you mentioned, again is a very important factor because that is very ardently used in cooking in India. So,
Yeah.
according to your suggestion, palm oil is something that we should stay away from.
Absolutely stay away
Yeah,
from it. Should,
yeah,
like, we as individuals, as consumers, if we boycott that,
yeah,
definitely the industry will pick it up.
yeah. Good. So, next question. Any other questions? So, the importance of diet during cancer treatment. This is, I think, something very, very important for
Yes,
all of us,
very
and even for me. Yeah,
that's very important in cancer treatment for two reasons. One reason is, have there is something called as psychological phenomenon. So we are talking to our dietitian, she's telling us this food is good for this factor, this food is good for this factor. When once we are explaining the patient of the goodness of the things they are having, they tend to have the more good psychological effect and tend to feel more better. So maybe not 100% better, but yes, 30-40% betterment I've seen when people are explained why you are having blueberries, why you are having pomegranate. Once they know the reason and they're consuming it, they feel psychologically much better. So one reason. Second reason, we all know with chemo there are a lot of side effects, loss of appetite, nausea, in some cases, terrible loose motions or something. So these can definitely, without any use of medications, we can manage via diet very easily. Not very, very simple tricks. For example, for nausea, sucking on a piece of very thin slices of ginger, add some fresh salt to it, and sucking on them and then throwing them out, it eases out nausea immediately. And having, using it 2-3 times a day before meals, so it can prevent nausea and you can eat food better. Similarly, for loose motions, terrible loose motions, the normal soft we get, the green fennel soft, the green fennel seeds we get commonly in India,
yeah,
having one
yeah.
spoonful of it can cessate the loose motions, can cessate the loose stools. So there are a lot of simple and sweet and very easy to do hacks which we can do and manage the symptoms and reduce the medicine load that ways. And we can ensure that the chemo goes smooth, so we don't have to stop in between due to a
Yeah.
symptom or any kind of side effect, or the patient is unable to bear it. So it is important that such kind of small hacks we keep on doing, manage the symptoms well, so that the chemo cycles are complete and they are out of the cancer. The cancer is in the remission stage.
So, if you don't mind, can I ask you a question from my side? So,
Sure.
breast cancer is still okay because, especially for radiation, at least chemotherapy, nausea would be there. For radiation, at least swallowing is not much of an issue. So, people tend to have as close to normal food as possible. But when you come to people with throat cancer or oral cancer, treatment is very hard on them. They won't be able to take any food. They invariably go into only having liquid diet. So,
Right.
for such a patient, in terms of having the most probable and the highest amount of calories intake to be taken through liquid diet, what would you suggest? What would you be a suggestion from
So
you?
when we speak about oral cancer or rectal cancer, wherein we see, giving food becomes a problem. So
Yeah,
it is important to give quality food. Therein, then we have to try that even if we are giving 1200, 1400, 1500 calories, it should give them the maximum nourishment, because we
correct.
know that there's loss of
Exactly.
they're not eating enough. So we need to, and we have to sometimes give them support formulas, protein powders and stuff, sometimes
Correct.
homemade powders, sometimes commercial protein powders, depending on the digestibility score of the patient, to give them the calorie density. So maybe I'll ask them to make a smoothie, fresh smoothie, and add a bit of nuts to it, so that even if they're taking half a glass, at least they get 300 calories out of it. We have
Got
to
it.
ensure that we're giving more nutrition in less quantity, because we know the
Yes. Yes.
tolerance is low. So therein we sometimes use commercial formulas, but then it is dependent on the patient's affordability for sure, and the patient's preference also, and the taste preferences as well. It is
Yes.
not
Yes.
blindly prescribing a commercial formula to everyone. But yes, it is always recommendable if if there is no provision of making a protein powder at home. I have plenty of recipes which we use, making protein powder or liquid stuff at home, making soup which are high in calories at home. But if that is not possible or cooking is not possible, then definitely commercial formulas can be used.
That will be very helpful. If you don't, would you be able to share those formulations that you can do it at home?
Sure,
That
I'll
will be
share a
very
couple.
helpful.
Yeah, yeah, definitely I'll share that.
Thank you. So, any other question? Next question. So, I think you've covered the diet tips during treatment for breast cancer patients.
Most of the tips I've covered, but one tip
Covered.
which varies from doctor to doctor and varies from individual to individual is eating raw food. So I have seen when people eat raw food, sometimes they end up having a salad which was pre-cut 1 hour or 2 hour before,
Yeah. Yeah.
predisposing them to risk of infections, and then in those infections can make the treatment more miserable. So it is important for fruits and vegetables specifically. Food you are eating freshly cooked, fine, but even if we heat it, the bacteria dies. But it is important when we are having foods which are raw, like fruits and vegetables, they should be fresh cut, or we should avoid having salads. We can saute the salad, like if we want to have carrot or beetroot, we can just saute it a little bit, like 30-40 seconds cooking. That ways we deactivate the bacteria present in that and it becomes safe. And fruits we generally prefer in some form of cancer wherein infection risk is very very high. Not in breast cancer generally, but in some form of cancer, we prefer fruits which are very thick skinned, banana, orange, very thick skinned fruit. But whatever fruit you are having, it should be properly washed. The knife should be washed. The person who is cutting the fruit, his or her hand should be washed, and it should be consumed immediately after cutting. We should not wait for the fruits, because fruits tend to have the highest bacterial load if pre-cut. And we can try and very thick, very thin skinned fruits which can carry risk of infections, or carry the risk of
Yeah.
nail contamination, the bacteria going through the nail of the person who is handling it. We should try and avoid them, like strawberries, for a matter of fact. When do you during the course of treatment, we can
Yeah.
try avoiding.
Yeah.
And we can also wash our fruits with warm water and salt solution to again disinfect them. And again, and one more thing, that whatever cutlery you're using, people generally are not very aware of that. So sometimes we have our cutlery open in the kitchen and there is a cockroach infestation in the home, and the insects are
Yeah.
going in and out. So it is important whatever cutlery you're using. Food is freshly cooked, hot, serving, served hot, fine. But the cutlery which we are using specifically for the cancer patient should be washed and then given to the patient to avoid infection, because we have to do our best bet to avoid infection at any cost, specifically in the areas where humidity is high.
Yeah. So these are very similar to all the COVID instructions that we got when we are living during the lockdown, that
Yeah,
keep washing your fruits and vegetables. But it's also
yeah.
important to know a lot of people used to overdo it, over washing and over cleaning.
And that is bad
Yeah.
for when they're saying for treatment, it is just for the during the course of treatment, when the chemo is
Correct.
going on or the radiation is going on, when the TLC or the blood counts are low. But once they are fine, I think we should resume back to the normal routine, because then overtaking those precautions, anything excess is bad. So
Excess. Yeah.
overtaking those
Yeah.
precautions, I have seen a lot of cockroach allergy coming up, in the recent past, in the last couple of months. I think people
Oh.
have been used to living into so sterile environment in those COVID years, that usually we get one cockroach allergy case in 100 reports. Now we get one cockroach allergy case in every 4 or 5 reports.
Oh.
So we should not overdo anything.
Yeah, that's true. That's very true. So, if there are any other questions, I think we can close to an hour now. I think we can close the session. So, thank you so much, Dr. Megha. It was such a pleasure and honor having
Thank
you.
you.
To be very honest, I don't know about the people listening in, but I have learned a lot. I have so many more new and better suggestions for my patients also to help them during treatment and post treatment.
That's, that's enough.
Thank you so much for joining us, and I will definitely keep in touch and would love to share some notes with you.
Surely, surely.
Thank you.
Thank you.